Hi, this is Dr. Pelto. I want to go over this 2015 wart treatment process. This is the way that we'll be treating warts in our office in 2015, and we'll do an update hopefully every year. So let's first go over what a wart is. There are different types of warts, but typically when you see a wart, you'll see these little black dots in there. Those are the blood vessels that feed the wart, and they give it its life source. And a lot of the treatment is going to try to destroy this blood source here. The two typical types of warts we see in the office here in Worcester, Massachusetts are a planter's wart, which is an individual wart, or a mosaic wart, which has multiple warts in the location. So let's kind of go on and talk the difference between a wart and a callus. So basically a wart is caused by a virus, and a callus is caused by friction. And the way you can tell the difference is if you look at a wart, you're going to see what we call an interruption in skin lines. So if this was a wart, you would see the skin lines go here and go around it. That's how you can tell the difference between a wart and a callus, whereas a callus tends to have the skin lines going right through it. Another way to tell the difference between a wart is that a wart usually has these little black dots in there, and as you trim off the top, you see the black dots that include the bleeding that happens in that location. So everyone asks, where did I get my wart? Usually this is a virus, and it's all around us. You can get it at a pool, a cut in the skin, wet or damp skin, or from others that have warts, and it is contagious. What can I do to get rid of it? It's anything that can create an immune response. So it's your body you want to have to deal with this. So you want to help your body to recognize it. Many people, before they come and see us in the office, they try freezing it, they try using topical acid, they try burning it or cutting it, all without success. This is our treatment process. I'd like to explain. There's three phases: phase 1, phase 2, and then the way to prevent it and preventing other conditions. So first, phase 1, we usually try an acid or some type of, this is a treatment that's called 5-fluorouracil, and this is called Carac cream, and this is used to kill the wart. It's also used for treating cancer, and this Aldera is actually used to treat genital warts, but can work on foot warts as well. Then we use laser treatment. This is the first type of treatment. The difference between using topical and laser, we find that laser is much more effective, but it's also a little bit more painful. Phase 2 involves wart removal and preventing recurrence. Different types of options we're going to go over as well. So let's start here talking about the topical treatment. Topical acid treatment is typically silicone or some other type of topical treatment. There are some other ones that are much stronger. They call them bug juice. Some are sold in the United States, others are not. If you go on the internet, there's 100 types of creams and liquids that they're going to sell. They all really base it on destroying the skin and destroying the tissue around the skin. And these tend to work very well, but they also kill all the skin around the area, so it becomes very white, very painful. They may blister up, and that's all normal. If you use it too much, though, I've seen some patients, they use too much of this cream or these acids, and it actually creates a sore and ulcer, so you have to be very careful when you're using this on a wart. The next type of treatment is a topical treatment, either Carac or Aldera. Once again, Carac is 5-fluorouracil, and it is used to treat cancer, skin cancer, and Aldera is used to treat genital warts, and both of those are pretty effective. Most types of treatments work better when you have some type of occlusion, and this is duct tape on top of it. It's not that duct tape is anything special, but it's the act of removing it that kind of pulls off a layer of skin, causes some irritation, but as well it keeps it there, otherwise your sock may irritate it. People usually, when they're having wart treatment, they are seen back in 3 weeks, and we evaluate improvement. Laser treatment is my choice if someone can tolerate it. It does cause some pain, and it produces a blister on the skin. You can see here, this is a wart. Initially, it creates a big blister, and then that blister pops, and then it tends to improve over time. People sometimes use a pumice, but really no other type of treatment is needed at that time. I usually see people every 3 weeks, and we'll evaluate success, and it's very, very effective for wart treatment. Phase 2 really involves wart removal when the topical or laser is not effective, or if people have only a few warts, we can remove them in the office or in the hospital depending on how many there are. The problem is you don't generate an immune response, and there is a high recurrence rate for that. Then you want to prevent recurrence, or transmitting it to anyone, so you'd like to wear sandals if you're in a public place, especially if you're swimming and doing activities like that. And then examine your feet. If you see any recurrence, you have to be treated quickly afterwards. Want to reduce odor, I recommend using Steri-Shoe. This is something to kill any fungus that may be in the shoe or any dampness that's in there, and Mycomist just clears if there's any odor in the shoe. Reducing moisture, we use something called Formidon. If people sweat a lot of people with warts tend to sweat at the same time, so Formidon can help, and then some type of dry wick-away sock can help to reduce that moisture. And then reducing pain, we like to either do some type of a pad on the area if it's a very painful area, like a weight-bearing surface, or an orthotic can adjust that pain level as well, reducing the pain temporarily until the wart is treated. If you want to learn more, you can go to worcesterfootcare.com/wart. And what I'm going to do is I'm going to kind of take you there and let you see what that looks like. There are some other treatment options there. So let me just show you here. This is what the page kind of looks like. This is a post-wire page that I put together. It has a patient wart handout you can look at. This is the wart treatment process we talked about. And this is some information about Carac cream, laser treatment, that Formidon, and then some wart therapy. So if you want to click on any of those, you can get some information. So this is just some information. Also, if you want to contact me, my information is right here as well. Hope you found that helpful, and look for more information on this site.